we have to do something between 400 and 600 repetitions a day.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Yeah, you might have heard
Oh,
this term called constraint induced movement therapy. Um, that's the kind of gold standard when it comes to individuals trying to improve their function. And that's where we're able to get to those high levels of dose, for instance, like a dose of a medication. And with neuro-rehab, trying to rewire our brains, that dose is not a pill. That dose is movement, volitional movement that you have to do. And just like normal PT or OT, where that therapist would be guiding you through those movements that you have to do to strengthen or reduce the tone, for instance, spasticity, or improve the precision of your movements. The robotic devices can help you do this from your home.
okay. Here I formulated the question.
Good. Okay.
Instead of now you're saying instead of me doing 30, 30 or 40 range of motion exercises, I should your equipment will have me doing 100 of the same range of motion type exercises.
Yes, on average, the individuals using these devices across the country, both the Motus hand and Motus foot, are doing something like between 300 to 400 repetitions an hour. So we're doing a lot, a lot more movements than your typical sessions.
And that increased, you're saying that increased, that much more movement is what stimulates the brain to rewire itself.
Precisely. With respect to, we kind of need two things to compare. So on the one side, if we go to the fundamental studies of actually measuring how the brain is rewired, in order for us to do that, in order for us to force a change on someone's brain, one movement will not do it. Two movements will not do it. In order for us to make lasting changes in those brain structures to improve function, we have to do something between 400 and 600 repetitions a day, which is a lot of movements. But let me contrast that with what is typically done in the outpatient setting. And that's what most of us are experienced with. In the outpatient setting, when you go see your occupational physical therapist for maybe 45 minutes or an hour, maybe 2, maybe 3 times a week, they've done really nice studies to quantify how many movements that those therapists walk an individual through. And the long and the short of it is they do around 30 to 40 repetitions a session, which are around an hour long. So if you kind of do that comparison, we're about tenfold off of what is actually needed. And the thing is those 400 to 600 repetitions are needed every single day, not just 2 or 3 times a week. And so we need a lot more rehab than the system can deliver it to us.
Oh.
But yeah, I think your inference is exactly right though. Yeah, so this is designed to help people get to that level of care that is very, very helpful.
Oh, okay.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
The only question I had is like, he just had his knee replaced about a year and a half ago, something like that. And before, when I worked as a nurse for years, we had patients in, they would be put on a continuous motion device
yes,
to make your knee move and keep it loose and all that jazz and help increase your range of motion. But when we went in, they said that absolutely was not the way to do it anymore. So I'm just curious,
Yeah. So let me just walk you through a little bit about this. So CPMs, or these continuous passive motion devices, they were used classically, right, in sort of the old school settings, and where I define new school as present day, basically. the old school settings, they thought that these systems could be used to help improve the range of motion, reduce DVDTs, for instance, improve circulation, all this sort of stuff, right? But and the concept is well founded. I think there's some rationale behind that. But one of the challenges is if you actually look at the evidence, when you look at what are called the relative risk ratios of individuals. Now we're talking about knee injuries here specifically. When you look at the relative risk ratios, it really doesn't have that much influence on reducing the relative risk of DVDTs, these sorts of things. Now, the problem is even more complex when you consider these tools, these CPMs, being used to help individuals with neurologic complications. For instance, traumatic brain injuries, spinal cord injuries, and strokes. The evidence there, again, it seemed rational, right? Let's move someone through some range of motion continuously and see if it helps them regain their motion. And so that's a reasonable assumption, but we have to update that assumption as soon as we get data. And then the data came in and it was very, very clear. There was no added benefit to this, right? And the reason being is in order for your brain to rewire, it is not sufficient for you to just have movements imposed upon you. You have to be actively engaged in those motions in order for your brain to respond.
You have to
For
be
instance,
a participant. Okay.
precisely, that is precisely what you have to do. The other way to kind of think about this, guys, is if, for instance, you or I were to sit in front of a piano that happened to play itself, right? That piano, if anyone was looking and you just had your hands there would be music coming out of it, right? It would look like you were moving and playing the piano. But as soon as you put you in front of a grand piano that didn't play itself, it might not be as pretty. And so just because you can have something imposed upon you does not mean you can do it in a challenge situation or do it for real independently. And for us, our goal is to help people regain as much functional independence as possible without the need of assistance. And so because we have to be participatory in those exercises, be engaged, basically your brain has to be trying volitionally very hard to do these things. Those CPM devices are not sufficient to cause benefits. They may be nice in terms of helping reduce pain, for instance. They might help just make you feel good, and that's great. But it depends on the goals. If the goal is to improve function, then we need to be actively engaged in the activities.
That's all I wanted to make sure that this would be a similar kind of thing.
No. So this device actually has the ability to move you just like a CPM device does, but it's not operating in that way. What it's operating under is operating under the inputs of a stroke survivor or survivor of neurologic injury. And those inputs, so it does have the ability to help sense your movements and either amplify them or help you initiate those movements. And so it has the ability to help you complete movements, but it won't necessarily do that for you without being actively engaged.
Any questions, Ken? I just wanted to ask that one. I'm sorry.
Yeah.
So are you saying the wrist device that moves that's used for that moves the wrist, for instance, are you saying that you have to, it's only assisting the wrist movement, it's not initiating it and moving it?
So it will help you initiate. Will help you initiate movements, and then by nature of you having it, so what it does is it has really, really fine sensors on board that can detect movements, small movements. We're talking sub 1 degree movements.
Right.
And what happens is, this is a really good situation for you, Ken, because you do have some of that trace movements. We can detect those, and then what we can do is we can amplify them. And it can, because it's detecting every couple of milliseconds, it's asking a question, hey, can it move? If so, let's try to bump it up a little bit. And it's a combination of looking at the forces that your body's putting out and when compared with the ranges of motion. And we can back out intent to move there. And we can operate on that intent to move and amplify anything that you do have in place. So it operates. It's like a a symbiosis, if you will, right? It's a hybrid between you and the robotic device with it explicitly designed to help amplify your movements.
Okay, what's up, Ken?
Any other questions from you guys?
I can't think of anything. Can you, Ken?
Okay.
No,
Right now?
I can't think of anything right now.
Can we think about it over the weekend and get back to you?
Yeah, of course, yeah. So this is, like I said, I'm supposed to be a resource for you guys. And so don't feel like this is the last time that we can chat either. So feel free to mull it over. And if you guys are ready to move forward, we'll be here waiting for you.
Where are you located? I was curious.
Yeah,
You in
no worries.
Texas?
Yeah. We're all based in Atlanta, Georgia.
Oh,
So
you're in
the
Georgia.
whole team is based here. Yeah, Atlanta, Georgia.
I didn't know where you were. I was curious.
Yep. Yeah, we founded the company in Atlanta, Georgia. We did a lot of studies here in Atlanta. The big randomized control trial was run out of Emory University here in Atlanta and the Cleveland Clinic. And so we've had some trials run in Arizona and a couple up in the Northeast as well. And so yeah, but our team, Motus Nova, is founded and headquartered here in Atlanta.
So
How many people have you had use the device?
Yeah, so that's a tough question to answer, actually, and let me explain why. When it comes to the clinical trials, we know exactly how many people there's several hundred individuals in those clinical trials, but there were a number of devices around, let's say 500 or so devices that went out to various clinics across the country. Okay. And because those devices were being used in patient care across the decades, we don't know exactly how many individuals those have helped. We know some of these devices have been in use for the better part of 10 years. And so those individuals are probably in the tens of thousands of individuals. With the new home-based systems, we're up at well above 1,000 individuals right now. So it's been helping a lot of people across the country. But we still have a long way to go because there's around 4.5 million stroke survivors across the country that have residual impairments that we're trying to help. And so we've come a long way, but we still have a long way to go.
So I would have a device that bolted onto my forearm that operated the wrist 100 times, for several hundred times a day, and then there would be another device that would bolt on my elbow that would bend the arm at the elbow several times a day, and then one for the shoulder and another device for the shoulder.
So Kenneth, our Motus hand is about the wrist and the hand. So that's what our upper extremity device focuses on, the hand and the wrist function. Okay. So it is going about that segment.
So it's just about the hand and the wrist.
Correct, sir. Now we do have, so when it comes to the improvements, we do see improvements from those clinical trials. So there are benefits that extend up to the elbow and the shoulder. And this is mainly because when you get improvements about your hand and your wrist, you're more likely to actually use it in daily life. And so by nature of doing that, you kind of, you stop forgetting that you have that arm and you start to integrate it back into your daily life. And so that's where we see those benefits extending up into the kinematic chain.
Okay, that makes some sense. Once you get the hand back, you
got it.
You can actually begin to start using the arm.
Precisely. And that's exactly what we want to do, right? Because my happiest day, Kenneth, is when you get some function back in your hand and you return the device, right? And that way, what happens at that point is you can start to use your hand in your daily life. And then your daily life is your rehab. And at some point, it's just your normal function. That's the happiest day for me.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.